Welcome, and thank you for joining us for this Becker's Hospital Review healthcare webinar titled Rethinking Digital Engagement, What Patients Really Want from Healthcare. I'm Carly Falk, and I am the head of research at Notable. In this role, I study health system operational challenges and generate thought leadership on the value of automation in healthcare. Before Notable, I was with the advisory board for 23 years, studying physician-hospital engagement strategy, population health, and clinical operations improvement. I also have a master's in health system administration with an emphasis in finance from the George Washington University. Let me just review our agenda today. There are three parts to this session. The first part is the status quo isn't working. Here I'm going to share insights from across the industry on why digital transformation in healthcare is really failing patients as well as the care team. In the second part, I'll share what patients want. And this is data and insights from our survey of over 1,000 patients that we conducted earlier this year, getting their insights into digital transformation. And then the third part is why automation platforms are essential, why point solutions aren't the answer, and why automation is a critical lever that health systems must pull if they are going to see their way out of this. So let's jump into section one. The status quo isn't working. Talk to any health system leader today and then talk to patients and the care team at the front line, and you are going to quickly find out that there is a disconnect between what providers offer and what patients use when it comes to digital engagement in healthcare. On the left-hand side, you'll see results from the Chime 2023 most recent report on the most wired healthcare institutions. And you'll see that for 86% of healthcare executives, they view patient engagement as an essential or a high organizational priority for 2023. But on the right-hand side, patients aren't using the digital tools that are provided. In fact, more than half of patients only use a health system portal less than 2 times per year. Well, I would ask, is this engagement? I'm engaged in my healthcare, and I search the internet probably weekly in search of healthcare information, but I don't go to my health system portal for that information. And the reason I don't go to my health system portal is here on the next slide. The portal, frankly, just doesn't meet my expectations. There are often login requirements. There maybe is an app download that I have to undertake, which creates the barrier. The portal interface provides insufficient information or explanation, which can be very frustrating. Just a personal story here. I ended up in September needing a blood draw, and I had a liver panel result that came back. It was 2x what it should have been. I went into the portal. I messaged my provider to try to understand why this was a problem. I then had to separately pull up the portal with the Mayo Clinic site to try to discern what, in fact, does this portal result mean. I then sent a message to the nurse who then asked the provider, and 3 weeks later, I learned it was nothing to worry about. And that is just not a very satisfying experience. It's not surprising then that 29% of patients just never use portals. They just don't go in. And health system leaders are sort of having this aha moment around this as well. You can see the quote in the right-hand box. We're going to explore something else because things like engagement really matter. And the EHR can't even tell us from an analytical standpoint how much engagement we're getting, what patients are looking at, and how well we're actually doing on engagement. Data from a recent class survey of 9,000 patient providers and vendors actually also illuminate how the investments in digital engagement right now are not necessarily aligned with the desires of patients. Look at the top 3 results here in this survey. Patients want to be registering and checking in for appointments. They want to be able to schedule appointments online. They want to be able to request refills. Yet there's really only alignment between patients and providers on paying bills. Not surprisingly, providers want us to be paying bills online. And then there's only really alignment between providers and vendors on finding a doctor. Otherwise, what you see is this enormous disconnect between what patients want and what, frankly, is being provided from a digital tool perspective. And the reality is a lot of this is due to the fact that EHRs themselves have been very, very slow to provide these features. So as a result, health systems are investing in point solutions to fill the gaps. But point solutions aren't really solving this problem either. On the left-hand side here, you can see first you have lots of different point solutions coming from different functional departments in the enterprise. And as a result, you end up with a very disjointed and disconnected experience for patients. In the middle, point solutions often create lots of downstream work for care teams because the data are going into silos and the care team has to compensate for that by re-entering data. And on the right-hand side, managing all those point solutions becomes a real IT burden for an overwhelmed IT enterprise. So put all of this together, and we would argue that the digital transformation is at an uncomfortable point when it comes to patients. Let's just see what patients have to say about it. And here we go into our next section, which is what patients really want from the healthcare digital experience. And I share with you here our results from our nationwide survey. We surveyed 1,005 patients in the United States in 2022. Our survey was conducted by the market research firm OnePoll across March 3rd through 5th earlier this year. And then you can see the demographic stats on the right-hand side. It was a survey of adults. It was representative of all regions across the US, and nearly 74% of the participants had received medical care in the past year. It was evenly distributed results from a sexual orientation standpoint, and it was representative, our survey, of boomers, Gen Xers, and millennials. Let's get to the results and the takeaways. Here I share with you really the 4 key takeaways in our findings. First, providers have invested in tools, and I've already shared this with you, but they really fall short of patient expectations. There's lots of hassles out there when it comes to digital access to care, and it's leading patients to actually skip care. And patients have clear expectations of what they want from digital, and I'll share those with you. And there are real improvements that healthcare providers can make to helping patients better access care using the right technology, and patients are pretty specific about what they want. First, patients are comfortable with digital tools, and they want them to help them make the most of their healthcare experience. As I already indicated, with my own experience, 67% of patients out there are using websites to search healthcare information, or are going to other places or portals to even try to get information about their care. 52%, more than half of patients, are using digital services to book medical appointments or fill out forms or pay. And then 3/4 of patients, would love to be able to use a digital tool to complete their paperwork, their intake paperwork online. But they're frustrated because digital tools are not delivering, and they go to the doctor, and frankly, they wait. You can see here, on average, patients wait 28.8 minutes for an appointment, and then see the doctor barely 17 minutes. That's a 1.7x difference comparatively between the time spent they're waiting and the time spent they actually seeing a physician. And this is extremely frustrating. So it's not surprising then that patients would say most digital tools are falling short of their expectations, and most patients believe this. On the top here, you can see 63% of patients say their providers' digital tools don't meet their expectations. 70% of patients are trying to do online scheduling, but they give up because they end up being redirected to call instead. And then 30% of patients have just given up altogether, and they're not using digital services at all to either book an appointment, fill out a form, or pay. And probably the most alarming result from this, patients are actually foregoing care over a bad digital experience. On the right-hand side, 61% of patients have actually skipped going to the doctor in the past year because it was too much of a hassle to schedule an appointment. Personal story here, I have had my local health system call me at least twice across the past 18 months to schedule my overdue mammogram screening. And I haven't done it because I can't schedule it online. I have to call the office to get it done. And that is a frustration. And, I don't have the choice of switching providers, but in markets where patients do have a choice, 41% of patients are actually switching providers because they're not having the digital experience that they desire. And it's not surprising when you consider the fact that we use digital everywhere else. We use it to shop, we use it for investing, we use it for banking. We know that the experience here can be better. And, as a result, patients are hopeful that tech can improve their patient experience. We learned that in our survey, 72% of patients said that they are hopeful that tech can actually improve their experience in healthcare. In fact, patients are pretty instructive when asked about what they want. Here on this slide, I share with you results that KLAS actually collected when they did their survey of patients and asked them, what do you value most when you choose to receive care? And it's all about convenience. They want high availability of appointments. They want to be able to get to the doctor easily. They want to be able to check in on online, and they want to be able to schedule online. And they frankly also want visibility and transparency into, are there appointments available, and what is the cost of my care going to be? Well, we asked for open-ended responses in our survey, and we actually got 155 across the 1,000 of patients that we surveyed. And they were remarkably specific. What patients want? Well, they want digital self-service, and they don't want to have to pick up the phone because the digital experience doesn't work. Here you can see, quote, I would love to be able to book appointments online with my PCP, but there's always a snag. Or second, can you make technology help better automate my experience digitally and then reduce the time I'm waiting to see the doctor? I want to do things ahead of time. On the right-hand side, also help me make the time I spend with the doctor richer, more focused, frankly, a better experience. If I check in online, it allows my appointment to time to be spent much more effectively with the physician. The physician does a great job. They are looking at my test results. They can offer a treatment plan right away. Frankly, as one patient said, get all that crap out of the way and just make my visit faster and better. And then they were also instructive on how healthcare providers can help. On the left-hand side here, simplify the payment process. And providers, frankly, want to do this as well. They want to make it, providers would love for patients to have an easier way to pay bills, and patients, frankly, want that too. And then on the right-hand side, initiate proactive digital outreach. Now, I think, and follow-up. Now, what I think is interesting here is I think this is a little generational. We've seen some surveys that say they still want to fill out forms, patient satisfaction surveys in written format. But we found in our survey that actually most, in fact, nearly all of the millennials and Gen Xers were more than happy to fill out those forms digitally. They want to be able to access this information online. They want to be able to fill it out via email or text. And, if you think about it, it shouldn't be surprising. A Pew Research Foundation study in 2021 found that 85% of adults use a smartphone. 61% of adults over the age 65 use a smartphone. And that was in 2021. We're now almost at the end of 2022. So people are ready and waiting to do fill out this kind of information and have a digital outreach experience that can address follow-up needs after care is provided. Health systems are facing a tipping point when it comes to digital transformation. And the demand for digital grows exponentially, not just digital capabilities, but automated capabilities. The goal should not be just to create a digital copy of what we did previously on paper. What you need to do digitally is create something smart. You need to replace manual, repetitive tasks done previously by people, because frankly, health systems don't have the people or the resources to meet the demand for talent. A couple of data points here. On the left, data from the August Kaufman Hall Hospital Flash Report. The 2-year increase in labor expense per adjusted discharge has been 17%. And it's only worsening with inflation pushing salary and compensation requirements higher. And on the right, when you look across the healthcare sector, sadly, traditional health systems are often positioned poorly when competing for talent. Tech offers the equity promise. ASC's virtual care offer predictable hours. Health plans, life sciences, purchasers often compensate at much higher rates. So sadly, the traditional health system finds itself in a losing position. And that is why automation must be part of the solution. At Notable, we believe every organization must invest in an automation platform across the coming years. In fact, we count over 200 manual workflows in healthcare that could be automated. Automation is going to become as critical to health system function and operations as, frankly, the EHR has been up until now. Point solutions are really just not viable long-term solves for these problems because they have integration challenges, because the ongoing maintenance burden for for the health system IT enterprise to try to incorporate that data is just unsustainable. At Notable, we believe you start this journey by automating for a single purpose, and then you build from there. And we would argue that the best place to start automation is on the front end, with patient engagement and intake. It has enormous benefits to patient experience, but it also creates significant efficiency across your organization. I mean, think about the experience part of it. Use one app to interact with Amazon. You search, you order, you watch videos, you pay bills, you reorder services, you manage subscriptions, all seamlessly through a single entry point and a single sign-on. Health systems have to take this lesson to heart because too often what happens is they let internal stakeholders, different functions, different service lines even work at cross purposes when it comes to the patient. Why is because each department often chooses its own best in breed app. But when every service or department has its own digital solution, the patient ends up with a lot of noise and friction. And then worse, you have data coming into your organization and going into silos. Duplicative systems that frankly require staff to manually manage work queues downstream, where they are then reconciling all those data inputs to get them into the electronic health record. Frankly, there aren't enough people to manage all of the work that needs to be done, and it's burning the care team out. So we would argue that you start by creating a seamless digital intake experience so patients can pre-register, they can check in, they can pre-process copays, they complete administrative and clinical intake forms before arriving at the office. And then from there, you build to outbound scheduling, care gap outreach, pre-surgical clinical intake, patient surveys, and the like. But you start by choosing one automation platform that's going to own those patient communications and then align your departments around the patient. With our customers, what we are working to do is create a proactive, consumer-centric digital engagement strategy that collects the right data in the right format and puts it into the EHR and the right systems directly. We push our customers to bring their entire team together to decide what's best for the patient and what is most efficient for the enterprise, and then from that, deliver a holistic digital experience. And this is what consumers want. They want consumer-grade experience in healthcare. Healthcare organizations know a tremendous amount about their patients, and that information can be used to truly revolutionize how individuals seek care and receive care. First, personalize your digital outreach. As a patient would say, know me. Create a user experience that's going to drive your patients to engage and complete activities prior to their arrival at your institution. And then leverage the trust you already have and remember me. You know a lot about me. Pre-populate information that you already have into my digital interactions with you. And as a result, let me just update that data and then feed high fidelity data and up-to-date information directly into your EHR. And then value me as a patient, anticipate my needs, use artificial intelligence and automation to actually uncover and prompt digital outreach based on what is already in your EHR to prompt and prevent chronic care management, acute care episodes when they occur. Our organizations and our customers are doing this already, even our FQHC customers. On the right-hand side, we share the story of Lowell Community Health Center, which is using intelligent automation to identify patients in need of care, and then reaching out in their preferred language at the right literacy level to connect and inform them of when and how and where to receive the care that they need. Again, this works at even a federally qualified health center, an FQHC, because patients, if they have nothing else, they almost always have a cell phone. So Lowell has worked with us to create a digital solution to get ahead of their population's health needs in a way that reaches their clientele efficiently and effectively. And you can see that happens to very, very high satisfaction. 96% of patients are giving a thumbs up in that interaction. And Lowell is just one of many organizations that we are working with nationwide to help transform digital patient experience, while we also bring productivity, analytical, and efficiency gains to the health system enterprise. On the left-hand side here, you can see a quote from Michelle McClure, the VP and Chief Experience Officer at Reed Health in Richmond, Indiana, where we are providing them newfound rapid insight into patient experience and access challenges. In the middle, Mark Thiel, former VP of Primary Care at ThedaCare, and then Dr. Patrick Colley, CEO of Medical University of South Carolina, both sharing how we are working with them to use digital outreach to help them manage community health by prompting patients to close care gaps like breast cancer screening, hemoglobin A1C tests, colon cancer screening, diabetic eye exams, and the like. When you do this right, you enable patients to engage with you in the way and time and place they choose, and you collect high-fidelity information that goes directly into your systems: registration, clinical, financial data, obviating the need for downstream work queues, and then saving time for your care team to do the right things for your patients. You can download our full report, What Patients Really Want from Healthcare, by going to the link that you see here, or just visit notablehealth.com, where you can both download the report as well as also learn more about how Notable is using intelligent automation to transform patient access and provider payment. Thank you for listening today.